name's Erin Orren, and I'm the Support Services Coordinator at Community Home Health and Hospice. And we wanted to make sure that we talked with you as our partners in caring for patients and families during this time. That we talk to you about grief and the challenges that we've finding taking care of people during COVID, and assuming that you're having those same sort of challenges. During this pandemic, it has upended our routines of daily life. It has narrowed those people that we get to participate in life with. And for many people, it has increased anxiety. I know that you all have had quite a few losses during this time. And so my purpose for talking to you today is really the amount of grief that has increased during this time. If you've had a loved one of your own die during COVID, the difference about not having a funeral or a gathering, we know that makes a huge difference in the way we allow ourselves to say goodbye to somebody and move through our grief. So just wanted to touch on a few different things during this difficult and isolating period. I think just really acknowledging the fact that this is something that none of us have been through, that we are in an unprecedented time. And, just giving each other a bit of cushion and checking in with one another a little bit more regularly. I think that as caregivers, we give and give and give at work. And we're meant to be very professional and kind of hold it together a little bit. And, oftentimes we see these patients more than their families do, especially during this time. And so the element of relationship has increased because of COVID. You may be a caregiver or a healthcare worker that always gives 150%. But at this time, you're giving 180% because you know how isolated people are. So then when you lose somebody during a resident or even your own family member, you have grief at work and you have grief at home. And the separation of the two and the ability to work through that grief has gotten almost impossible. So I just want to acknowledge, first of all, that this is hard, and this is unlike anything we've ever done. So I think that those things that we normally would do to get through grief, being limited, we have to think of different ways to work through it and to purposefully push ourselves through it a little bit right now. Just understanding the nature of grief, I think that it's important to realize that there's so many more emotions when you're in grief. There's, it's spiritual, it's emotional, it's physical. Grief affects you mentally. So your whole body is affected when you're in grief. There could be elements where you feel like you're forgetting. There could be elements where you feel numb. Grief creates this great sense of sadness. And just that desire to be with that person who died. As professional caregivers, we are people who are supposed to be able to handle this and let go. When you have many people die at the same time, multiple losses every week, the multiple grief that goes on top of grief really is a factor. And it weighs on us heavier because we're not really knowing where to put that stuff. So, grief is a normal reaction to loss. It is what we go through in many different kinds of losses that we face through our lives. Right now is sort of stunted grief because we don't have anywhere to put it. So I think that, if you think of it as a normal wave pattern, you might think now it's a wave after wave after wave after wave. And so to get back up is getting more difficult. So if you're feeling heavy and you're feeling like you're not coping well, it should be kind of expected. but there are things that we can do to soften those reactions. One of the major things that we really need to do is give ourselves permission to grieve. Because I think that, sometimes as professionals, we feel like we don't get that space. If you see a person that you're working with and you see them having a hard time, maybe even just taking a 5-minute coffee break and saying, tell me about what's going on. Tell me about George who just died yesterday. Tell me what you miss about him. Trying to get dialogue with your peers. Even if you have people in your bubble, maybe even talking to them about, I just feel like I'm holding all this grief and it's really weighing me down and making me heavy. I think that, we are trying so hard to keep each other safe that we may not be addressing each other's needs. So thinking about it in a different way of how can I get my needs met, and how can I make sure that my coworker is doing okay too. So thinking about it differently. I think with that is creating a daily routine. It may be that you are really thinking about your self-care in a different way, where you are more on routine and you're trying to act like you're normal even through this pandemic. And routine really helps with grief as well. So getting out of bed the same time every day, eating at regular times, planning times for exercise, planning times to touch base with other people, and maybe even having a checklist of things that you want to get done during the day. Giving yourself motivation to keep moving through. That is just the idea of routine kind of just helps you sort of feel like you have some control of what's going on. And then also with that routine, maybe you carve out a bit of time for grief. There's a lot of people that I work with that in bereavement that just don't know how to do this grief thing. And, they would cry throughout the day and they would feel like they have no control over it. Well, I had suggested maybe have grief time, where every day at 8 o'clock at night that you light a candle, you maybe play music that reminds you of that person, maybe you have a picture of that person, and you actually plan to just feel, and allowing those feelings to come up and out of you. And, I know that we avoid grief because it doesn't feel good, but sometimes having that planned time where okay, I'm going to get that tonight. I think I'm going to hold on until tonight, and then knowing that you're going to address it, and then allowing your body to feel it, kind of allows you to just keep going through the motions during the day, but then, releasing that heavy emotion whenever you do that grief time. I think that some people try to push off grief so bad, they don't want to feel it, and they're not allowing themselves to let it come up, that then it hurts them in different ways. Physically, maybe they get sick more often. They start getting a little bit crabby with the people they work with. And it also is a real strong way to go right to caregiver burnout, when you are not addressing your own feelings. So there might be, the grief time might be a way that you can do that. So, maybe creating that part of that routine. Through grief, we really say, because you are feeling so down and low, really trying to put self-care really high on your list of priorities. Because your emotions are so down, it's easier that your immune system is compromised. And then you're working so hard on top of that. Everything seems to be harder when you're in grief. That maybe really trying to focus on good sleep, hygiene, really keeping the room dark, keeping it cooler, going to bed at the same time, really trying to eat as well as you can, as clean as you can, avoiding processed food, avoiding alcohol and substances, and really trying to keep an eye on your spiritual health as well. Having that part of your routine and keeping your self-care, if you feel good physically, sometimes you can feel better emotionally. So keeping the focus on that too. Through this pandemic, I think that we are needing to remind ourselves to just be gentle with ourselves. I think that we expect so much out of ourselves. And as caregivers, we give and we give and we give, and sometimes we forget to replenish our own bucket. So however that looks for you, it might be worth it for you to take time to journal or make a list of what does replenish you, what does make you feel like you are whole, what makes you feel like you are being nice to yourself, and then allowing yourself to be high on your own list. As caregivers, we give so much of ourselves away that we sometimes don't have anything left to do for ourselves. So I just want to encourage you to be gentle with yourself. You are somebody that cares for others, and you're somebody that wants to give. Please try to give to yourself. And then, reaching out for support. I think that as caregivers, we want to take care of our coworkers also. So, maybe say to your coworker, gosh, I just need to debrief. I just need to talk about, Patty, who just died. And do you have 5 minutes? Taking the chance to ask. Maybe they can't do it right then, but maybe they could do it in 15 minutes. Or maybe you can plan to call them tonight and after work and just debrief. If there's not somebody at your work that you want to talk to, maybe actually reaching out the phone and actually calling your friend at home, or calling your friend instead of texting them, calling them instead of emailing them, and actually having a conversation. When we are so isolated with COVID, I think that purposefully connecting to other people has to happen. So I think grieving in isolation is not going to help. It's not. And so however you need to do that to get the support you need, we need you to do that. You need to do that for yourself. I do know that sometimes you just worry that texting is so much easier because I won't worry that they're busy. But I think hearing somebody else's voice and hearing their concern for you and being able to just talk, it meets a different need than texting. So I just want to encourage you to do that. If you feel like this grief is getting you where you don't feel like getting out of bed and you don't feel like eating well, or you're eating all the time, or you can't sleep at all, I would suggest that you might call your doctor and just say you're having a hard time. Doesn't mean that they're going to put you on medicine, but it does mean that you're reaching out and you're acknowledging that this is hard right now. And sometimes that is all we need, is to hear ourselves say, I am struggling. And so sometimes even just saying that allows you to make that phone call to your friend, or allows you to say to your sister, you got to come over, I just need to talk. So if you're feeling like you're getting to this point where you're worried about yourself, or if you knew your friend was doing what you're doing, and you wouldn't allow that, don't allow it for yourself. Calling the doctor could just be making it yourself aware, and speaking it out loud could help you just to go get help for yourself. There are online support groups. Here at Community Home Health and Hospice, we have in-person support groups. We limit them to 5 people altogether, so it's 4 people and a facilitator. And you can register to come in to a support group. Other places have online support groups, and if you need to just be with others and hear what others are doing in their grief, it really is a good way to get new ideas. Some people feel like it's just down and dreary, but it isn't. People are laughing. Certainly when people tell their grief story, it's sad. But a lot of times these support groups become a natural support system, and they do support each other in other areas of their lives, and they talk about other things, and they enjoy each other. So, if you could just maybe consider joining a support group, even if it's online, that is sometimes a good option too. There are grief counselors that are available. You can make an appointment with us at Community Hospice Grief Support. A lot of people are doing virtual grief support. Your insurance probably covers that. So those are just a few different ideas about support. I think that one thing that we are missing right now is that ritual of saying goodbye. And so here at hospice, we do an honoring when a patient dies. We gather around the patient's bed, and any staff that have worked with that person and their families will come in and gather around the bed, and we talk about that person, and we say goodbye to him or her, and we acknowledge what we have learned from them or have seen from them, acknowledge what the family has gone through, and we usually pass a token around the bed. That's a little more tricky with COVID, but we still do that honoring, and it's just a ritual to help us say goodbye and help families say goodbye. It may be that you want to consider creating your own ritual. I know that you're being affected by the patients that have died in your facility, and so I don't know what that looks like for you, and I don't know if it would be an agency-wide thing, but a goodbye ritual could be as simple as when you get home from work, you light a candle and you think of that person. It could be as simple as when that person dies, you go and you touch them and you say goodbye to them. It could be as simple as just writing their name in a journal that you keep for yourself so you don't forget their name because you have so many patients that you see. I don't know what it looks like for you, but taking the time to think of something that would honor them and help you say goodbye to them is a really great way to continue being able to do this work. This work does take some emotional taxing, and it takes some extra thought to how are you going to release some of this. So I am a big, huge fan of rituals because I think that they elicit more of your senses in order to say goodbye to somebody. So think about that too. Something that you can do is write a letter to a patient. If there's one that has just been around for a long time and they impacted your life, and there's funny stories that you have and you don't want to forget, maybe you have a private journal that you write that little story or write a letter to him or her just to say goodbye. You can also make a playlist of songs that you know that they loved. I'm not sure that you would know all of those, but maybe a playlist is something that would help you through your grief, and taking the time to create that maybe for yourself would help you elicit feeling and getting through grief also. So with this time, we wanted to, I wanted to give you this little thing. It's called Tips for Living. And it's just 10 things that I think are really kind of nice, and we all should practice them because honestly, we just are not very, sometimes we're not very purposeful, and we just go through the day and we just make it through instead of really trying to live. So this says, number one is to be kind to yourself. And I in a grief support group that I give a list of different ways to be kind to yourself. And there's thousands of them. Take a bath, take a walk, pet a dog, whatever it is. But every day trying to do something that is kindness to yourself. Number two is celebrate each day. Making something that you can take from that day that is something that you can celebrate. And I don't know if it's just that you made Marjorie smile, or if Ralph wasn't cranky with you, but that's a celebration. So really acknowledging those things. Number three is surrounding yourself with loving people, and picking your friends wisely and picking those people that lift you up. Number 4 is being aware of the stressors in your life. And so if that means that you are limiting watching news because you're already overloaded with all of the trauma and trials that are going on, then limit the news. But if that is causing more stress for you, just being aware of that and choosing not to do that. It may be just for a short time. Number 5 is remember you are mind, body, and spirit. So thinking about each parts of those things, of those parts of your life, and addressing needs that you have within each of those. Number 6 is learning to love yourself. 7 is develop quiet times, times to just unload your mind and think through things. 7 is prioritize the things that are important to you. I'm sorry, that was 8. 9 is share life's memories with significant others. And 10 is to work on finding inner peace. So, I know that this is a struggle right now. And I'm going to share these tips for living with your boss. And, that might be something that you can try to work in your day. We're also going to bring a circle like this. It's not going to be actually this one, but a similar thing to this. I think we dropped off a wreath maybe before, but it'll be a circle, and it will have some ribbon available to it, and next to it will be a list of the symbols of colors. So each day as you go into work, I'm hoping this will be maybe in a break room, and as you go into work, if you could cut off a piece of ribbon in whatever color you think symbolizes the feeling that you're most having today. So if I grabbed purple, I'm feeling guilty. I'm not right now, but I could be. So whatever feeling you're feeling, and whether that means that you're feeling guilty about a patient issue or something at home, but whatever emotion you feel is bubbling up the most today. And then you just tie that onto the circle that I'm gonna leave at your facility. And it's really kind of a way that you and your management team can figure out how people are doing. It'll be done anonymously. Nobody will know what color you put on there. But as you look at it, you can say, oh my gosh, there's lots of negative feelings up there. I mean, there's a lot of sad and guilty and depressed, or angry. And if you look at this and you compare it with the circle, then you can really kind of get a vibe about what people are feeling. And it may make it be a catalyst for you to reach out to your peers a little bit more. Or if you put black on there every single day, it may make you feel like, I better do something about this emotion I'm feeling. So it's just a little encouragement of being aware of our emotions. And I just do want to say, if you guys need additional support, I just want to go through what grief is like with COVID. But if you do need additional support, we are here for you. We'd love for you to call us. I know your management team has our phone number. We're just the grief support at Community Hospice. And we really would love to help you out if we can.